Well, good afternoon, everyone. A warm welcome. Thank you for coming back. It's Wednesday, the 26th of February. Now, a bit of an update on a few different countries now and what seems to be going on. So, the virus is severe acute respiratory syndrome 2. The disease is COVID-19. Coronavirus disease 19. Now, these are the current confirmed cases in China, but now, of course, there are cases in other parts of the world as well. And the great thing about China at the moment is, as we're going to look at in more detail, the number of cases is going down, or the increase is going down. There's still more cases, but the rate of increase is dramatically slowing, and we'll look at reasons for that. Now, accumulated confirmed cases, suspected cases, and again, this is only China data, that number suspected but not formally diagnosed. Current severe cases in China. Now, this number continues to concern me. The relationship between that number there, that should be a comma, of course, 8,752 cases. That is quite a large percentage of that number there. So the number of people getting severe disease from those formally diagnosed continues to be a major concern. Confirmed deaths worldwide from the Johns Hopkins website is 2,763. Recovered, mostly from Chinese data, that has to be said, is 30,257. Countries affected is now 40. Now, this basic reproductive number, I was giving a figure of R0 equals about 2.6. Now, if you remember yesterday, this R0 figure is the average number of uninfected people that one infected person will infect, and it indicates the speed of the epidemic. But we did look at data yesterday that showed that the R0 in the early parts of the epidemic in China were much greater than that. So this massively depends on the circumstances that the people are in. So if there's good containment facilities, as there is in China now, now I don't have a figure, but I would guess the R0 in China now is probably about, make up a figure, it's growing slowly. It's growing slowly in China. It could be about 1.2-ish, something like that, because of a lot of shutdown. But we know that this virus can have much higher R0s than this, as we saw from the data yesterday, as happened in the early stages in China. So the R0 in Iran, we've no idea what the R0 in Iran is, but it could be absolutely anything. But it could be, well, let's just say it could be well above that figure, quite well above that figure. We don't know exactly what it is, but it could be 3, 4, 5, 6. We simply don't know. So I've just put massively variable on that one. So that's the basic figures for today. Now, moving on to other things in the news and what this helps us to understand about the virus. Now, the World Health Organization have told us that this is a rapidly expanding outbreak, that's the word they use, outbreak, at the risk of becoming a pandemic. So having said they don't use the term pandemic anymore, they've now said this is at risk of becoming a pandemic. Now, moving on to Japan. Right, 178 confirmed cases now in Japan. Sporting events cancelled for 2 weeks. The Prime Minister said there's a large risk of infection if sporting events were to carry on. And of course, the Olympics are due there in July. So a lot of anxiety in Japan at the moment for several reasons. And a 4th death has been announced from a passenger who was on the Diamond Princess, many of course who are still isolated in Japan. So unfortunately, I think we're looking at a spreading contagion in Japan. Moving on to South Korea. Now, in South Korea, it's 37 days since the first confirmed case on the 27th of January. And yesterday there was an extra 253 cases, making 1,261 cases on Wednesday the 26th of February. There's been 12 deaths. Now, the Koreans are very upfront about this. In fact, of all the countries where the virus has gone, it seems that the Koreans are the most straightforward in their reporting of it. And they have very significant diagnostic facilities. I would say more than any other country apart from China. So widespread testing is underway. Now, this sect in this town that started spreading this virus, the testing, I think it's all 200,000 members of this sect are going to be tested. So that means in addition to the tens of thousands of tests they've done already, they're going to do another 200,000 tests, which is a significant ability to test, a significant capacity. The Korean Centre for Disease Control has told people to avoid public gatherings, and they seem to be having tents outside hospitals so the infection doesn't get into the hospital, which is good. So quite a bit of spread there in Korea, still reasonably localised, but there is spread now in all provinces of Korea. But this is good because this is all very trustworthy data from the South Koreans. Now, moving on to Iran, the Islamic Republic of Iran. We've just said that South Korea is very upfront and very transparent, whereas Iran, that is more questionable. They say they've got 95 cases, and it just so happens that an MP's got it, the Deputy Health Minister's got it. It's just so happened that people that went to Canada met some of these 95 people. Just so happened that the people that are infected in Bahrain and the United Arab Emirates also met these 95 people. This is just not credible. So we can infer a lot about the data, a lot about the number of cases in a country by the number of spread, the amount it's spread in travellers. In the case of Iran, it's spread widely. So we know these cases are way higher than the Iranians are claiming. And the other thing about Iran is it's got the fairly high death rate. So I'm really worried that this is a mutant virus that is more pathogenic, that has a greater pathogenicity, a greater ability to cause more severe disease. And if that's the case, it's the last form of the virus, the last what we call a serotype of the virus that we want to spread. So let's hope that's not the case, but it looks like from some cases I've had from reports in Iran that the death rate is higher. The case fatality rate is higher than in other places. Now, this guy here is the Iranian deputy, a Minister of Health, who's just tested positive. And his press conference yesterday, he affirmed that Iran had the outbreak under control. Then an hour after that, a couple of hours after that, he tested positive himself. The same health minister, this guy here, Iraj, had said he would resign if numbers had been covered up. And this gentleman, who's very senior in Iranian health ministry, said that quarantine doesn't work. It's a World War II method, and they've gone beyond that now. Or so he seems to think. But an MP has tested positive, meaning that other members of the Iranian parliament could well have been affected. There's panic buying in supermarkets. But there's no mass lockdown like there is in China. People are still coming and going to holy shrines in Iran. Now, needless to say, this sort of thinking from a senior health official is terrifying and potentially devastating for many people in this world. It's just beyond belief that someone could have such a completely unscientific view of this. I don't know if it's a possible side effect of the theocratic government in Iran, a sort of fatalistic attitude, but to reject scientific methods is just, well, there's nothing to say, is there? Now, Afghanistan has an open border with Iran, and Afghanistan has very limited infrastructure. There is one confirmed case already. And if it gets into Afghanistan, it's going to be very difficult to stop. People tend to live in compounds and family groups. And to say limited healthcare infrastructure doesn't start to describe it. And of course, the massive security problems there as well. Now, Tenerife I saw videos of people walking around this hotel talking to each other, where these people are isolated after the Italian doctor tested positive. That's concerning. And there's also a confirmed case in Barcelona, which I put that there because they're both Spain. As I said, I do hope the Spanish authorities in Tenerife have learnt from the Diamond Princess failure and are learning from this. But people are not allowed to leave the hotel grounds now. There's police outside it. Many of those at the moment we assume won't be infected. Let's hope they do not become infected. So moving on to the situation now in Italy. This large outbreak in northern Italy. But unfortunately, we now know there's also a case in Sicily, or more cases, I'm not sure, and also in southern Italy as well. So mostly in the north, but it has already spread. 323 confirmed cases in Italy with 11 deaths. And it does look like this disease has probably been in Italy for longer than people realise. So it's probably a recognition matter. This disease could have been there for several weeks. We're not really sure. And they haven't been able to contact the index case or case 0. So it's still a bit of a mystery how this COVID-19 infection got into Italy. Good quarantine measures are being taken in Italy, which of course is very reassuring. Austria, there's a hotel locked down in Innsbruck with an Italian receptionist. So again, we're seeing spread from Italy. Switzerland, Croatia reported positive cases. Now, Australia. The Australian government has activated its emergency response plan to an impending coronavirus pandemic. They are the words that they are using. So it looks like Australia is starting to take this pandemic seriously. And I'm glad to see that the United States Centre for Disease Control, Atlanta, is also taking it seriously. This is one of the CDC spokesmen. It's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will have severe illness. This is exactly what I've been saying for weeks. The question is how many people are going to get severe illness, because it's going to be very difficult to look after a lot of them all at the same time. Now moving on to China. The number of new cases in China is declining massively. 406 new cases on Wednesday. Excellent decline in the number of new cases, meaning each infected person in China is on average affecting many less people. In other words, the R0 is going down. Now, yesterday I read a letter from Beijing, an email from Beijing, and we talked about the city being 95% closed down, businesses, restaurants, bars, 95% down. Passes needed to get into residential districts, being checked for temperature when you leave the residential district, when you go to the supermarket, when you come back, needing identity cards and identification, and this clampdown that's happening in China, although some people are being allowed to go to work. And this was praised by the WHO. And actually, I agree with this. Now, in China, the level of, well, I was going to say mismanagement, but it's more than that. Deliberate cover-up in China was appalling, and that gave this epidemic time to get going. It could have been potentially nipped in the bud, eradicated, if the local authorities had taken a different attitude. It's a tragic missed opportunity. But now China's taking amazing action to try and limit it, praised by the WHO. Now, I talked about that case in Beijing yesterday. This one is from Shanghai. I'm currently in Shanghai. Just watch your recent video update where you read an email from someone in Beijing. Everything they mentioned in their email is happening here too. So the situation is the same in Shanghai, one of the other great cities in China. It's been incredible to see the collective response of the people in taking action. It's been incredible to see the collective response of the people in taking action against the spread of the disease. And I agree that it's hard to believe any city in America would be as ardent in their efforts as I've seen here. So we do really have to extend our thanks and acknowledgement to the ordinary citizens in China who are making extraordinary efforts now. And even the Chinese central government now is making extraordinary efforts, using powers in a positive way after the tragic missed opportunity in the early stages. Now, new UK, testing of symptomatic people. So people with any symptoms now of cough or fever, reporting to GPs, and 11 hospitals in the country are being tested for COVID-19 virus. So basically this is asking the question, is the virus already spreading in the country? Are some of the normal clinical features that we see at this time of year actually COVID-19? And we should know those results probably in about 48 hours. So that's good surveillance. So the question is the virus already spreading in the UK? We don't know, but this should answer that, hopefully. And they haven't specified, the UK authorities haven't specified, but I strongly suspect these are selected to be representative of the country as a whole. So it will be reasonable to take these samples as representative samples of the country as a whole. Now, 8 schools are closed in the UK. Pupils have visited northern Italy. Very pleased to see that schools, individual head teachers are being proactive. This is not from the senior medical director in the country, chief medical officer. It's the initiative taken by the schools themselves, which I applaud. It's good. They're closing the schools just in case. Children are working from home and can be taught from home online by their teachers. Now, just to end this update, the vaccine situation. Now, a vaccine has been developed in the United States and in China. And as far as I know, there's a couple dozen other labs around the world working on this. And my understanding is that the US vaccine and the China vaccine are now being tested for safety in animals. Now, the next stage after this in early spring will be phase 1 human trials. Now, in phase 1 clinical trials, the drug, or the vaccine in this case, is given to a relatively small amount of healthy volunteers to make sure that it's safe to test on larger numbers of volunteers. But then it's got to be tested for efficacy, it's got to be tested for side effects. This is not a quick process. So realistically, we're not going to see a mass vaccine ready for the public this year. It's going to be next year when we have this vaccine available.